First through the door is 31-year-old Natalie, whose condition is so embarrassing that she's had to endure the humiliation of taunts from children.
I've had children shout out to me in the past, "Oh, you've got cancer on the face." I avoid being out when the kids come out from school. It's also learning to live with pain. If I've got something bad on my bottom, then I don't sleep much.
Why are you here?
I've been suffering with boils and cysts since the age of 12. It's just a living hell, and it doesn't get better, it's getting worse. I seem to get a boil and it will pop, and I can still take stuff out of it years later. I've got ones on my face and on my back and on my bottom that will still produce pus 7, 8 years after it's popped.
Okay. Let's have a look. They are very sore looking. That's one there now, which is, that's active at the moment, isn't it?
Yes.
And they're leaving big pits in your skin, aren't they?
Scars, yeah.
Big. How will this one progress, for example? Will that get bigger?
Over the next few days, that will get much, much bigger and angrier. And then eventually it will burst.
It will burst. And does that leave a kind of a smelly...
Yes.
Yeah,
yes, very
smelly, bloody...
Hot, smelly and bloody.
Do the little pits then, are they uncomfortable?
Very.
Yeah.
Yeah, it's just always uncomfortable. I never really have a day where I don't have pain.
And what about the skin on your face? Tell me about that.
I could squeeze my face all day long and bring stuff out of it and start again the next day and squeeze all day long. There is just always something to take from my face, always. It's just the top part, not the bottom.
And this is obviously quite annoying as well, because trying to sleep on this or anything is...
Very much so, and I will never, ever, ever show my back off.
Natalie suffers from one of the harshest and most painful forms of acne, cystic acne, which is actually quite rare. But 85% of the population will experience some milder form of acne at some point during their lives, with those aged between 15 and 25 years most likely to suffer. However, roughly 5% of both men and women are still experiencing some form of acne at the age of 45.
My suggestion would be to see a specialist dermatologist and go through all the things that you've already had and then discuss an appropriate mix of perhaps antibiotics to deal with the flare-ups and try and break the cycle of that, and then maybe a laser treatment to try and help with the scarring, so to do the two together. You know, I think even a small level of improvement for you would be a huge step.
Yes, very much so, yeah.
We'll find out how Natalie gets on later. Earlier, Natalie came to us with a chronic skin condition.
I've had children shout out to me in the past, "Oh, you've got cancer on the face."
Treating Natalie's severe cystic acne will require her to have pixel laser resurfacing treatment. It relies on the natural healing process of the skin. This special laser carefully zaps the scarred skin, allowing the healthy skin to rejuvenate underneath. But it won't be a quick fix. Natalie will have to undergo up to 6 treatments over many months with Dr. Puneet Gupta.
Her skin, as you can see, is gone red, which is normally a good sign that she's got good water content in the skin and likely to respond very well to the treatment.
I feel okay. I have been badly sunburnt before, so it kind of feels like that, really. My back is fine. That just feels hot and slightly throbby, and my bum feels fine. So, yeah, so far so good.
But the laser treatment isn't going to help with the much larger and deeper pockmarks on Natalie's face.
Some of the deep ones, like this one on your forehead and some around the chin area, they're probably too deep for the laser. So what we're going to do today is do some graft in it, which simply means we'll cut these scars out and replace it with a normal piece of skin from behind the ear.
Because it's her own skin being grafted, it should fuse into place naturally with no need for stitching. But Natalie will have to keep the wounds under plasters for a week.
Bring you into the mirrors up. But I look lovely, don't I?
We'll be catching up with Natalie later to see if all that zapping and grafting was worthwhile.
I'm not going to have those deep holes anymore, so yeah, I'm really excited to see how it's all going to look.
summer, Natalie came to us with a chronic skin condition. So we sent her off to have her acne scars zapped and a facial skin graft. A couple of weeks later, Natalie is back to see Dr. Pixie, and she can't wait to show off her new skin.
Hi there.
Take a seat.
Thank you.
I wouldn't have recognised you.
Oh, wow, thank you.
Amazing.
Thank you.
So you had some laser treatment and some tablets.
The doctor who's been treating me asked me to kind of gauge when I was having outbreaks, and they always tended to be day 14 of my period when I was ovulating. So he thought that it would probably have something to do with my hormone levels. So actually said it would be probably best for me to be on the contraceptive pill.
Has that made a difference?
For me, it's been life-changing, yeah, absolutely. Dr. Gupta also did some skin grafting on the deeper scarring that I had. I don't know if you remember specifically, there was one that I had here that I used to call my bullet hole. It was just so deep.
I can't stop looking at you, sorry.
I know.
It's amazing. That's incredible. Really is. It was a big mess of pockmarks, wasn't it? On a scale of 1 to 10, how less angry would you say that is?
Oh, 10 out of 10. I just feel like I've been given a new back. I can't wait for summer so that I can actually wear little tops.
Looking at this now, I remember these quite vividly. They were sore, they were red, they were angry.
Yeah. I would say that the pill is definitely making a difference in that I'm not getting any newer outbreaks anymore. To look at myself and see what I consider to be normal-looking skin, it just thrills me.
Natalie's skin is fantastic and, you know, far supersedes my expectations of what it was going to be like. Just goes to show she's had this for 20 years. It's always worth asking, is there anything new out there that can help you?
Next week